Hi, everyone. Today we're going to have our webinar on preventing chargebacks in your practice. This is what you need before a dispute ever happens. So we hope that you get a lot of good information about the protocols you need in your practice to limit chargebacks, and if you actually experience one, then what to do. So just before we get started, this is educational information only. We're not attorneys or accountants, and laws and requirements vary by state. So you need to consult your legal and accounting professionals for guidance specific to your practice and location. So here's a scenario. It happens when you least expect it. A letter arrives from your payment processor. You open a notice about a chargeback for $1,200. The patient had been coming to your practice for 3 years. They loved their results before, but this time the outcome was not what they expected. So they called their credit card instead of calling you. The bank had already taken the money from your account while they investigated. So you have 20 to 30 days to respond, no money in your account, and you have one chance to fight back. What you need to do is step one, save the relationship. Contact the patient, find out what went wrong, understand why they called the bank instead of calling you, and do it immediately. Call or text within 24 hours. It's better to call. Listen without being defensive. Document everything the patient says. Follow up with an email. Then in addition to that, step two, you need to save the money. So you need to send the paperwork to your processor. The paperwork must prove two things: that you delivered the service and that they agree to it. They don't evaluate, the bank doesn't evaluate whether the treatment worked. They evaluate whether you got the documentation they need. So you need to know that going in what they're looking for. So what the bank looks for with documentation, what strengthens your chargeback response to the rebuttal is the signed financial agreement, which is separate from a medical consent. The patient needs to initial a no refund policy. They need to have a detailed receipt in explaining exactly what the services were. Before and after photos with consistent lighting and angles showing that the service was completed, and documentation that you did a follow-up text, phone call, and proof that the card was physically present for purchase. The real cost for this is it's more than a dollar amount. It also involves time and hours spent gathering paperwork, fees. Sometimes the payment processor, regardless of the outcome, charges a chargeback fee, and then the attention it takes for this dispute along with a damaged relationship. So these are all things to consider. Chargebacks are not won or lost at the time, but before the treatment ever happens. So you need to go through and do a self-audit of your workflow. These things that will strengthen your chargeback disputes, if you ever have any, is to make sure that patients signed a separate financial agreement, make sure they initial a no refund clause, make sure that the chip card was inserted or tapped, not typed by hand, and make sure the receipt lists exactly what was done, not just a basic medical service offered. And then that you followed up with 48 hours. That's a pretty good protocols that you could look at. And then one item that you should really consider checking immediately today is to make sure that your payment terminal, Visa card terminal, doesn't have the settings turn off for auto decline if the zip code and or the chip is malfunctioning or mismatched. Sometimes that's turned off, and that is a problem. You don't want to be keying in the credit card because that means you lose some protections. Here's some things that you should consider before the visit to help with the process. With a online booking, even if a customer comes in or a client comes in, you could have them create the booking online themselves, even with an iPad. That creates a digital trail showing intent, making sure that the patient fills it out. It proves that they personally made the appointment. Phone bookings are fine, but they don't create the proof that the digital trail provides with the online booking. You cannot skip what you should make it mandatory that they understand about your cancellation policy and your no refund policy during the booking phase. And addition to that, it should be on the device where it's recorded, the time and the date, and have that logged automatically. Most booking sessions do that. That's why it's always important to, even with a phone consult, have them come in and ask them you can actually have your staff fill most of it out and then ask them to just finish the rest of it from the digital trail standpoint. It's always important to tell your staff not to take credit cards over the phone for new patients specifically, because when you type the credit cards in by hand, you can't prove that the card was physically there, and the bank can assume fraud with respect to that. So best to go ahead and have the send the Stripe, best to go ahead and have the Stripe and or PayPal system used to go ahead and take the payment instead of doing it over the phone. You can always send them a link by email, which gives you those protections. So just from the standpoint of your business with terminal settings on your credit cards, these are some pretty basic, not basic, but standards that you should consider. You need to make sure that your credit card system is set up for the auto decline for a zip code mismatch. Also, if the security code on the back, CSV, is a mismatch, that needs to auto decline. And then you need to disable force authorization, which prevents staff from forcing through a decline card. That forcing a decline card is a guaranteed loss if disputed. So those are your safety protections. Don't think that, particularly with new patients, if those things come through as mismatches, then you actually should consider those as red flags. So you need to make sure that these protections are in place and go over it with your staff. With the check-in, you need to make sure that the photo ID is a government-issued ID and that it matches the name on the credit card, particularly for a new patient, even actually, quite frankly, a well-established patient. It's good to get a copy of the photo ID and put it in the patient file. If there's a mismatch, then you need to stop and ask questions, particularly if the patient is using a family member's card, parent's card if they're younger, a spouse. You need to make sure that you have an authorized approval for that purchase, particularly if it's higher dollar, because of the obvious concerns. You can consider having an authorized credit card authorization form with the actual card holder and a copy of the card holder's ID on file. But you also need to just be careful with that. With the chip rule is actually very important. It's best to use the chip, insert the chip into the reader, or use the tap or contact list. If in fact the key, they want it keyed in because the other two don't work, then suggest Apple Pay or Google Pay because that leaves a digital footprint. And in fact, the other two options are your other protections. The magnetic stripe is your last resort, and I wouldn't necessarily do that from the standpoint of security. For the paperwork, medical consent's not enough. You need to make sure your no refund policies in 3 visible places on your website, visible in your frequently asked questions section. In the good faith estimate, any estimate is required over $400 that you give a good faith estimate, and they need to understand about your no refund policy and that estimate, and they need to sign it. And then also a good idea would be to put it on the front desk area, just somewhere close by, saying that they're paying for the services. So basically the role there is the bank's really looking for proof that the patient knew the policy of the practice before they came in and before paying. So the more touch points they have with that, it's a stronger defense. In addition to that, with the medical consent form, that's perfect and perfectly fine for your files. But you also need to have a financial agreement form signed, which is a separate document that covers the payment terms. And it should be separate so they understand that they are actually paying for services, and understand that not all of the risks, side effects, and results or 100%, that it's optional and could potentially take 1 or 2 or 3 sessions to get optimal results. The financial agreement really, of all of these, your financial agreement form should cover the services versus outcome. You need to have a script that you use and you have your staff use very comfortably. These are samples that we've got referenced here about saying that here's one, for example, I understand that payment is for services provided, time, expertise, and products, for example, and is due regardless of the aesthetic outcome. And all sales are final. We do not offer refunds. And then agree that if there's a dispute, that they wouldn't necessarily charge back. So some people may not be willing to do that, but you should have that in your form. The quick check. So where do you stand right now? How many of the items do you have currently? Do you have an online booking with a mandatory policy checkbox saying they understand about no refund? Terminal settings, make sure they're correct. Make sure the photo ID is reviewed every time someone comes in, and have that separate financial agreement set up. Look at that itemized receipt and make sure that that's done correctly. And then also have your 24 to 48 hour follow-up showing that you're giving good patient care with respect to this situation. So even if you are missing one of these, it's fairly easy. Most of these are fairly easy fixes. So you can go through and just make sure, as a quick rundown, to cover the basis on all of that, and you'd be in pretty good shape. And that's basically what the bank's really wanting to see. The other part is during treatment, so that you have covered the basis and made sure that you've got good documentation you want to, before starting, which is actually pretty basic. I think most of you are all practice this, but you want to make sure to say, before we begin, I want to confirm your name and we're doing this treatment. Is that correct? Yes. And have them agree to that. Then during the procedure, if anything changes, particularly if the patient wants more units, if you adjust the plan from the good faith estimate, if something's added, you need to get the patient's approval, and then you need to write it down right away so that they understand and make sure that it's documented while they're there. That way they can't dispute any charges or changes. You want to make sure in their chart in front of them, write down why it changed and what changed. Note that the patient agreed to it verbally and include the new total cost. So in addition to that, you need to make sure that your notes for charting are descriptive. So from a bank perspective, if you have weak notes, then that could be a problem. So if you just write in 1 milliliter filler to lips, patient tolerated well, compared to timeout performed, we confirmed the plan with the patient, 1 milliliter of Juvederm Ultra to the upper and lower lip, discussed that asymmetry is normal during healing, patient verbalized understanding. So big difference between the two. Here's the other one, Botox to the forehead, timeout performed, 30 units neurotoxin, and reviewed that movement and will increase gradually over 7 to 14 days to the patient. So these notes are your documentation showing that you discussed the outcome of the service that you're offering and providing. So you need to be specific, document their tolerance, and also note what you said. That gives the paper trail on your side of how you conducted the treatment. So what actually wins a chargeback is, and it's not an us versus them, so that doesn't really come across as the right way, but what actually does win is all of the above, but you need to have a very detailed receipt that they've signed showing the medical service and the treatment package. And then also that if in fact it's going to take 3 or 4 services or sessions rather, that you reference that on the receipt. You don't want a generic receipt. Have them sign it. So if they've signed it, it's a good indication that they were satisfied. The other consideration is you should always have before and after photos. The before photos, make sure their face is clean with no makeup. Do not do any prep. Take every photo without any kind of prep or numbing. You want to keep the originals, make sure there's no editing. Typically there's a meta stamp of some sort, a timestamp on these photos, which need to be put in the medical file. Make sure for the after photos, the angles match the before photos. They're in the same location, in the same room, same lighting, and replicate everything exactly. Now, one thing I want to mention that, you have to get the photos for the medical records, and that's actually different than use for social media. So you need to have them with respect to your patient care, get the before and after photos. And so when you're getting consent for that, they need to understand that it's stored in the patient file. It's not used for social media. If you want to use it for social media, then you need to have them agree to that separate from that. That's optional. The before and after photos for the patient care are not optional. You need to get them. So you should have all of that in place. And that this should be a routine check. So here's a couple of just pointers and ideas for you before you ever have a chargeback. Hopefully you don't, but these are always good things to catch before they become chargebacks. Always call or text the patient after the service. You can give these to your staff, these scripts, just saying hi, name, checking in. Remember that some swelling is normal for the first few days. Please let us know if you have any questions. The billing descriptor, sometimes the patient doesn't recognize the charge on their credit card as being associated with the clinic. So, for example, your LLC may be your first and last name LLC, but you go by your first name's business clinic. So if in fact your LLC shows up on the bill, but the name on the door is different, you either A, should let them know that, make sure they know that that's what's going to appear on the credit card, or just actually the easier thing, the better thing to do for making sure you're okay and not having any kind of dispute or, chargeback because someone doesn't, it's called a friendly chargeback. They didn't realize that that was you, is go into your credit card system and have it match. So if you have a different name on the door, then have your credit card provider have that show up on the bill. The second one is you should always have, before the treatment, the understanding this is a script, but this is that they understand this is an elective service. Results vary from person to person. So no outcomes guaranteed. Many treatments require more than one session, and the payment is the service that you're providing today, not basically have them to contact you directly if they have any issues or concerns. And if you routinely do that for every single patient and you document that you've gone over that, then that gives you some real leverage with the credit card company, showing that you have procedures in place that eliminate these concerns. So one of the main reasons why you get a chargeback is from a disappointed patient. It could be the patient's unhappy. They thought that this service was going to be something that would be much different result than they expected. And you deal with that probably routinely. So, you have to, come up with some scripts that would help with the resolution of this without them going to a chargeback. So, we've put some scripts here together about the responses on how to manage that. These are, obviously not can and should be tailored to your voice. These are just, samples. But the important thing is to document everything, what the patient said, what you offered, whether they accepted your offer. And then if they later file a dispute, you can show that to the bank that you tried to resolve the situation. Now, one thing I want to mention is the double refund trap. If the patient says they filed a dispute with their bank already, you need to make sure your front desk staff knows this, and you also need to know this. Don't go ahead and refund them of course, your policy is no refunds, but you need to make sure that this, in fact, once it goes through the bank's process, that you do not refund them the money, because the bank will refund them the money, and then you can get the money back from the bank, and or vice versa. So once the chargeback's been filed, you do not issue a refund, but that's called the double refund trap, and they'll get their money back and then get your money. So the patient, you need to train your team so that if the patient mentions that they filed a refund, they do not offer a refund. You need to work through the bank to resolve it from that point. So here's your response pack. You have 20 to 30 days to get your responses. You should set yourself a target of 14 days. It could take and some issues, that you have to resolve, questions, etc. So give yourself a little bit of lead time. Here's what you need for your items in your packet to the bank. You need that transaction receipt, which shows that the chip was inserted, billing zip matched, and the security code matched. You need the signed financial policy showing that they agreed and that the no refund clause was highlighted. They need that signed medical consent showing that results vary, and also show your treatment notes. Now, because of HIPAA, you may feel concerned that you need to be mindful of HIPAA, but you do have the ability to give very basic information about just this transaction. If you have a history with the patient, obviously you shouldn't give information about any other services you offered. But make sure that the treatment notes are shown. Remove any sensitive details, of course, but keep the date, name, and procedure. Always have the before and after photos with your timestamp and your original files available. Any communication logs, texts, emails, and also a cover letter with a professional summary of what the patient did, how they participated. And then the other thing that actually is very good from the bank's perspective is if you have actual proof of 2 or more previous visits within the past year with this patient. It demonstrates that you have a history with this patient, and gives you a little bit more credibility. So it's always good if you have that, you can show some level of history in your cover letter. So just the goal of this webinar is chargeback prevention. So we went through this sample of what happens when you get one, but this helps you with respect to preventing these to begin with. So if you do get a chargeback, even a small one, you're going to get some codes. The reason code, services not provided, not as described, or unrecognized. So these ones that the patient said never received anything, you should have those better receipts, signed invoices, and photos to document that claim was not accurate. Not as described is basically not, their interpretation is not what I was promised. Your role there is to make sure there's better expectation setting and document your conversations about not all results are equal. And then the unrecognized is typically the billing descriptor is not matching what your name is on the sign. So that one's actually a pretty easy fix. I would check that right away. That way, particularly, you could have a situation where a patient, went through and had a service done, and then their person who pays the bills, which may not be them, sees something and says, wait, what, we didn't charge that, and files a chargeback just with basically a friendly chargeback because they didn't know. So your other consideration is your monthly checklists. Again, we talked about it. Test your booking link. Make sure they have the checkbox showing your policy, and make sure they can't skip that. Check your terminal settings, your consent forms. Review any chargebacks kind of like as a spilt milk opportunity to discuss, hey, what can we do better if in fact that happened? Your billing descriptor, which we discussed, and then spot check your charts. Are you doing a good job with your descriptions? Because 6 months from now, if you have an issue, you don't want to have a problem there. Retrain your staff, and then also check your photo quality. Those are always good practices there, so you'll be in touch. But anyway, these are basically the summary of everything. With these, just how chargebacks are won and lost before the treatment ever happens. We've summarized the points into a single sheet checklist for you, so you can print it out and use it for your audit. If you're interested, you can email me at anna@medopsmanuals.com or text me at 863-605-1855. And yeah, that's it. So we appreciate you coming, and we will see you in the next one. Take care.